There are about 150,000 people waiting for an organ transplant just in the United States. And most of these people will die waiting. There are other alternatives available. We are trying to use non-human organs to replace human organs. We are genetically modifying these organs to make them more acceptable to humans. And also we are working on the immunosuppression and trying to modulate the immune system in a way that these organs are accepted without using extensive immunosuppressive drugs. We are the ones who have produced the longest surviving Xeno heart in a baboon. At the NIH, we did an abdominal transplantation of a pig heart into a baboon to better understand the immunology of rejection and to design ways to prevent or avoid rejection. In that experiment, we transplanted the heart in the abdomen, leaving the baboon's heart intact. So in that way, if the heart rejects, the baboon doesn't die. But that heart doesn't help in the survival of the baboon. We did that experiment to understand the mechanism, how a non-human heart would reject, and then to design different ways to overcome that rejection. And we've been successful in doing that, and we've been able to keep that heart alive for over 3 years. When I moved to here, we are continuing the same experiment, but we are now transplanting the hearts in its original place. We are replacing baboon's heart and hoping that the success we have achieved in the abdominal position, we will achieve the same success in its natural position, and these animals will survive with the big heart for a long period of time. You know, pigs were chosen as the ideal candidate. It's not the closest match to human, but for several other reasons. For example, you know, these pigs grow very fast, so we can and they breed in captivity. So you can have these pigs within like a couple of months, and you have a heart that can match the size of a human heart, and then it's been consumed in food and several other products. So there are less ethical concerns about it, you know, and we know the genetics of the pig, so we can easily manipulate that genetics to make it more acceptable to human. We will test different genetically modified pigs. We will see what other barriers we still have to overcome to make this the donor perfect for human. So when we transplant this heart in humans, it will not reject or will require minimal immune suppression, and our goal is to use immunosuppression even less than what is used in human to human transplant, because the immunosuppression causes more problems than the transplant itself. So one big advantage of these designer hearts will be that they will require less immunosuppression than even the human to human transplant. So what we are doing here now is we are transplanting these hearts, replacing the baboon heart, and, you know, testing different immunosuppressive regimens and testing different genetic modifications. Some of these animals will have several human genes expressed on them. So we're basically humanizing these pigs, you know, so they will get accepted easily. So we cannot do human experiments until we do all these translational work and prove to the FDA that, you know, this can work. Then we have to do some safety studies and then approach FDA. And FDA is very receptive. I mean, because of our work that we've done at NIH, and we are continuing to do it here at University of Maryland, you know, FDA is very receptive to what we are doing. And based on our work, there are a few other centers who are also getting into this work for different organs. I'm interested in heart, but there are other people who are interested in other organs, and then they are also trying the same methodologies to prolong the graft survival, and we all are you know, trying to approach FDA with with a solution, and then hopefully we'll get permission to do human clinical trials. Everyone should know that this is a viable process. You know, this is not just an experimental thing. This is a viable option, and we can in future, you know, use these organs for transplantations. And you know, we have made a lot of people believers in this, and hope to make more believers all around us.